Before you take someone's blood pressure, you want to make sure that person has been resting for about 5 minutes. You also want to make sure that person hasn't taken any caffeine or nicotine in the past 30 minutes. As they sit down, you want to make sure that both feet are flat on the ground and uncrossed. They should be seated with their back straight and their arms should be elevated to at least heart level. You want to make sure you are also using the right cuff size, since using one that is too big or too small may lead to inaccurate blood pressure readings. The blood pressure cuff should be wrapped 1 inch above the elbow tightly. The arterial mark should also be aligned with the brachial artery. You're going to place the stethoscope over the artery, trying to keep it flat on the skin so you reduce the noise around the area. Make sure the thumb screw is all the way to the right side, and then you will start to inflate the cuff to about 180 or 200 milliliters of mercury. Then you're slowly going to release the pressure by 2 to 3 milliliters of mercury. As you release the pressure, you're going to hear a clear tapping sound. That will be the systolic pressure, then a swishing sound followed by crisper and louder tapping. The sound will then muffle and then disappear. This will be the diastolic pressure. When this happens, you will release all the pressure from the cuff. When using the table, you can see the systolic and diastolic pressure to classify if their blood pressure is too low, normal, or high.